Hello everyone. Here we are going to discuss a very small topic, that is reticulocyte. In your university exam, you get short or very short question either on reticulocyte count, that is retic count, or reticulocytosis or reticulocytopenia. So let's discuss this topic completely, that is reticulocytes. We are starting the topic known as reticulocytes. So first of all, to understand the reticulocyte, you have to understand erythropoiesis. How does RBCs are formed in the bone marrow? You have to see the precursors, because reticulocyte is one of the precursor in RBC formation. Then you have to understand the introduction of the reticulocyte. What is reticulocyte? How does it look like? Then I will tell you two special stains to stain the reticulocyte. You get a very short note on them, the special stains for the reticulocyte. Then I will tell you the retic count. What is normal retic count? And what if the retic count is more, that is reticulocytosis? And what if the retic count is less, that is reticulocytopenia? So I will let you know the causes of reticulocytosis and reticulocytopenia. So one by one we will discuss them all. So let's start it. In the blood, there are three types of blood cells: RBCs, WBCs, and platelets. We know that the RBCs are known as erythrocytes, the WBCs are known as leukocytes, and the platelets are known as thrombocytes. We know that. Where does these three cells are formed? All the blood cells are formed inside the bone marrow, and the formation of blood cell in the bone marrow is known as hematopoiesis. Hemato means blood cells and poiesis means synthesis. So it is the synthesis of blood cell inside the bone marrow. So let me draw a bone marrow for you. Here all can see I am drawing a bone marrow for you. Inside the bone marrow, the first cell, the ancestor of all cell, which gave rise to all the cell, the precursor of all cell, is known as hematopoietic stem cell. So the first cell is hematopoietic stem cell. From this hematopoietic stem cell, two stem cells arise: the myeloid stem cell, and lymphoid stem cell. You can see here I am writing lymphoid, myeloid and lymphoid stem cell. Now the myeloid stem cell give rise to RBCs. The myeloid stem cell also give rise to platelet, and myeloid stem cell give rise to 4 WBCs out of 5. Total 5 WBCs are there, out of which 4 are arising from myeloid stem cell. Which 4? Neutrophil, eosinophil, basophil, and monocyte, but not the lymphocyte. So only lymphocyte is remaining. That lymphocyte is arising from the lymphoid stem cell. So lymphoid stem cell give rise only to lymphocyte. So that's why the myeloid stem cell is known as trilineage, because it is giving rise to RBCs also, WBCs also, and platelet also. That's why it is giving rise to 3 different lineage of the cells. That's why it is known as trilineage. So currently I'm not interested in all this. Complete mechanism is known as hematopoiesis, that is formation of blood cells inside the bone marrow. But currently I'm interested only in one of the wing of hematopoiesis, that is how does RBCs are formed from the myeloid stem cell. So that is known as erythropoiesis. I am interested in that because I want to teach you reticulocyte. Okay, so the precursor cell is the hematopoietic stem cell, which is CD34 positive. The marker for hematopoietic stem cell is CD34. It's CD34 positive. So you can see the first cell is hematopoietic stem cell. Okay, it gave rise to myeloid stem cell as well as lymphoid stem cell. The myeloid stem cell give rise to RBCs, it give rise to platelet, and it give rise to 4 WBC out of 5. Neutrophil, eosinophil, basophil, and monocyte. And the lymphoid stem cell give rise to lymphocytes only. That's it. So we have understood. So the same thing is written in front of you. Now I am interested in erythropoiesis. So basically hematopoiesis means synthesis of RBC, WBC, and platelet inside the bone marrow. The 3 together is known as hematopoiesis. The synthesis of RBC is known as erythropoiesis. The synthesis of WBC is known as granulopoiesis or leukopoiesis, and synthesis of platelet is known as megakaryopoiesis. So the 3 things together is known as hematopoiesis. But currently I am interested in erythropoiesis only. So let me tell you, from the hematopoietic stem cell, the first cell is hematopoietic stem cell. From that, ultimately RBC, how does it form? So there are various precursors in between. You have to learn the precursors. So these are the precursors in front of you. So as I told you, the first cell is always hematopoietic stem cell. It is giving rise to myeloblast or myeloid stem cell. It is giving rise to pronormoblast, then early normoblast, intermediate normoblast, late normoblast, then reticulocyte, that is my topic right now, and finally RBC or erythrocyte. So these are the precursors. So first cell is hematopoietic stem cell. It gives rise to myeloblast, then pronormoblast, early normoblast, intermediate normoblast, late normoblast, retic, and RBC. Learn the other name of early, intermediate, and late. Early normoblast also known as basophilic normoblast. Intermediate one also known as polychromatic normoblast, and the late one also known as orthochromatic normoblast. So you can learn with the help of a mnemonic BPO, early, intermediate, late, BPO. So tell me the complete sequence. How does